In this video, we'll dive into the most common glaucoma treatments, from medications to surgeries, and uncover the hidden truths that most people never talk about. You might be thinking, glaucoma. It's just eye drops and pressure, right? Well, think again. Glaucoma is more than just a condition that affects your sight. It's a silent thief that can slowly steal your vision without warning. Often, it develops with no symptoms, and by the time you notice something's wrong, irreversible damage might already be done. But don't worry, there's hope. You'll learn about side effects you didn't know existed, lifestyle changes that can boost your eye health, and cutting-edge treatments that are shaping the future of glaucoma care. Ready to take control of your eye health? Stick around. This is the info you won't find anywhere else. Alright, before we dive into treatments, let's take a moment to really understand what glaucoma is. Simply put, glaucoma is a group of eye diseases that damage the optic nerve, often due to high eye pressure, known as intraocular pressure. This pressure builds up because the fluid in your eye, called aqueous humor, doesn't drain properly. Imagine your eye like a little balloon. If there's too much fluid and it can't escape, the pressure inside that balloon rises, putting pressure on the delicate optic nerve. Over time, this can lead to irreversible damage and vision loss. Now, glaucoma isn't just one condition. It has a few different types. The most common is open-angle glaucoma, which develops slowly and without symptoms, making it even harder to catch early. Then there's angle closure glaucoma, which can come on suddenly and cause severe pain, nausea, and even vision loss if not treated immediately. The tricky part is that both types can result in permanent damage to the optic nerve before you even notice anything is wrong. This is why regular eye exams are crucial, especially if you're over 40 or have a family history of the condition. In fact, the key to preventing serious vision loss from glaucoma is early detection. The symptoms can be incredibly subtle or even non-existent, so regular checkups with an ophthalmologist are your best bet. The earlier the disease is detected, the more options you'll have for managing it effectively and avoiding long-term damage. Now that we've got a good understanding of what glaucoma is, let's talk about how it's treated. There's no one-size-fits-all approach to glaucoma management, but the goal is to lower eye pressure to prevent further damage to the optic nerve. Let's break down the most common treatments. First, we have medications, and in most cases, this is the first line of defense. The most commonly prescribed glaucoma medications are eye drops, which help reduce eye pressure by either decreasing the amount of fluid your eye produces or by helping it drain more effectively. Some of these drops include prostaglandins, which increase fluid outflow from the eye, and beta blockers, which reduce fluid production. These medications are effective for many people, but they're not a one-size-fits-all solution. Some individuals may experience side effects like eye irritation or a decrease in heart rate, so it's important to monitor and adjust treatment with your doctor. For those whose medications don't work or who need additional help, surgical procedures might be necessary. One common surgery is trabeculectomy, which creates a new drainage pathway for the fluid in your eye, reducing the internal pressure. Another option is tube shunt surgery, where a tiny tube is implanted to drain the fluid. And then, there are laser treatments, which are becoming more and more popular. Selective laser trabeculoplasty, SLT, and argon laser trabeculoplasty, ALT, are procedures that help improve fluid drainage and lower pressure in the eye. Laser treatments can be a great option for those who don't respond well to medication alone, or for those who prefer a less invasive route than surgery. Each of these treatments works in different ways, but their goal is the same: lowering the eye pressure to prevent further optic nerve damage. The choice of treatment depends on the type and severity of glaucoma, as well as how your body responds to each therapy. So, as you can see, managing glaucoma is a bit like tailoring a suit. What works for one person may not work for another, and it's all about finding the right fit for you. Now, let's talk about something that's rarely discussed: the hidden truths behind glaucoma treatments. As straightforward as they may seem, there's a lot more to the picture than meets the eye. For starters, some treatments just don't work for everyone. Glaucoma isn't a one-size-fits-all condition. What works for one person may not work for another, and that's why personalized treatment is so important. A medication might lower your eye pressure initially, but over time, it could lose its effectiveness, or it may cause side effects that outweigh the benefits. This is why glaucoma management is often a trial-and-error process, and your treatment plan might need frequent adjustments. Speaking of side effects, let's be real, glaucoma treatments can come with their fair share of them. Eye drops, while effective, are notorious for causing irritation, dryness, or even a weird taste in the mouth. And if you're using drops for a long time, you might experience other issues, like eyelash changes or redness in the eye. Surgical procedures and laser treatments, while effective, also carry some risk. Complications like infection, inflammation, or even worsening of eye pressure can occur, though these are relatively rare. But it's important to know that no treatment is completely risk-free, so always weigh the pros and cons with your doctor. Another truth is that lifestyle factors play a surprisingly big role in the success of your treatment. It's not just about taking your meds and hoping for the best. Your diet, exercise, and stress levels can all affect eye health. For example, eating a diet rich in antioxidants and omega-3 fatty acids can help protect your eyes. Regular exercise, particularly aerobic activities like walking or swimming, can also improve circulation and reduce eye pressure. And don't underestimate the power of stress management. High stress can exacerbate a range of health issues, including eye pressure, so incorporating relaxation techniques into your daily routine could make a real difference in how well your treatment works. So while the right treatments can go a long way in managing glaucoma, it's not just about relying on medications or surgeries. Your overall health plays a key role too. And the more you understand these hidden aspects of treatment, the better equipped you'll be to take control of your eye health. Now that we've covered the tried and true methods for managing glaucoma, let's take a look at some of the exciting new treatments on the horizon. The field of glaucoma management is constantly evolving, and recent advances in research could completely change how we approach this condition. One of the most promising areas is new medication options. In recent years, there's been a push for medications that can target the problem in new ways. One example is Rho kinase inhibitors, a new class of drugs that help improve fluid drainage in the eye. These medications work differently than traditional eye drops, and early studies suggest they could be highly effective for patients who don't respond well to existing treatments. While these medications aren't yet widely available, they show a lot of promise for the future of glaucoma management. Another cutting-edge treatment that's generating a lot of buzz is stem cell research. Imagine being able to regenerate damaged optic nerve fibers. Sounds like science fiction, right? But it's closer to reality than you might think. Researchers are exploring ways to use stem cells to regenerate the optic nerve and restore lost vision. While we're not there yet, clinical trials are underway, and the potential for this type of therapy is mind-blowing. Similarly, gene therapy is also making strides in glaucoma treatment. By targeting the genes responsible for causing the condition, scientists hope to be able to correct underlying issues that lead to optic nerve damage. While this is still in the experimental stage, it offers hope for those who have advanced glaucoma and limited treatment options. Now, let's talk about some alternative therapies that people often turn to. Natural remedies, acupuncture, and herbal supplements are among the most popular alternatives for managing glaucoma symptoms. While there's some anecdotal evidence that these treatments can help reduce eye pressure or improve overall eye health, it's essential to approach them with caution. Many of these therapies have not been scientifically proven to be effective for glaucoma, and some may even interfere with traditional treatments. So while they might provide some benefits, they should never replace the guidance of your healthcare provider. If you're considering alternative therapies, always discuss them with your ophthalmologist to ensure they won't disrupt your current treatment plan. With all these new developments, it's an exciting time in the world of glaucoma treatment. The possibilities are expanding, and while we don't have all the answers yet, the future looks brighter than ever. So what can you do right now to take control of your glaucoma and protect your vision? Well, the first thing is to schedule regular eye exams. I can't emphasize this enough. Early detection is key. Especially if you're over the age of 40 or have a family history of glaucoma, routine eye exams can catch the condition before it does any permanent damage. Your ophthalmologist will check your eye pressure, examine your optic nerve, and assess your overall eye health. Even if you don't have symptoms, these exams are a lifesaver when it comes to catching glaucoma early. But it's not all about the doctor's office. Your lifestyle choices matter too. Managing your glaucoma isn't just about taking medications or getting surgery. Simple daily habits can have a significant impact on your eye health. For instance, staying hydrated is crucial for maintaining good eye pressure. Dehydration can lead to higher eye pressure, so make sure you're drinking enough water throughout the day. Also, reducing caffeine intake is another simple change that can help. Caffeine can increase eye pressure temporarily, so try to limit your coffee or soda intake, especially if you're sensitive to it. Exercise is another powerful tool in managing glaucoma. Regular physical activity, like brisk walking or swimming, can improve circulation and help reduce eye pressure. It doesn't have to be intense. Even moderate exercise can make a difference. And don't forget about protecting your eyes from injury. Whether it's wearing protective glasses during sports or avoiding environments where your eyes could get hit, keeping your eyes safe from physical trauma can prevent further damage. Lastly, always consult with a specialist. Glaucoma is complex, and your treatment plan should be tailored to your specific needs. An ophthalmologist or glaucoma specialist can guide you through the process, recommend the best treatments, and help you make lifestyle changes that complement your treatment. It's essential to work closely with your doctor to monitor your condition and adjust your approach as needed. Taking action now, whether it's scheduling that eye exam, making small lifestyle adjustments, or consulting with a specialist, can have a profound impact on your ability to manage glaucoma and protect your vision for years to come. So now that you've got a solid understanding of glaucoma and the treatments available, it's time to put this knowledge into action. Remember, early detection is key, and the lifestyle changes you make today can have a huge impact on managing your glaucoma tomorrow. Have you scheduled your next eye exam? Are you making those small daily adjustments that can improve your eye health? If you found this information helpful, don't forget to like this video, share it with anyone who needs to hear it, and subscribe to the channel for more valuable health insights. Hit that notification bell so you never miss a video. Check out the next video on the screen, where we dive into even more health topics that can improve your life.